and good evening, everyone. Thank you for finding time to participate in our live session today. I am Kanda Rungrangsi, a medical student from Kaen University, and I will be your moderator today. And welcome you all to an international webinar topic medical education in the time of COVID-19 pandemic from students' perspectives, hosted by Medical Student Union Kaen University, Thailand. And we made this webinar because we realized that countries across the world went into quarantine and social distancing, and medical school had been highly affected, and the outbreak had put us away from the classroom and clinical training. And today we are really lucky to have 4 medical students from 4 different countries to share their perspectives on medical education during COVID-19 today. But before we get started, I would like to invite Associate Professor Julapan Ingjanin to give our welcome speech for us. President Julapan, please.
So lady จุฬาภัณฑ์มีคนฟังเยอะมาก
Okay. Shall we start now? ได้ยินไหมได้ยินเสียงจันไหม Hello?
Yeah, we can hear you.
I can hear you.
Okay. เริ่มเลยนะ Okay. Ladies and gentlemen, I am really delighted to welcome everyone to this special webinar. It is such a precious time to see a great participation from all. Due to the COVID-19 outbreak, our usual practices of medical education have been disrupted at unprecedented pace and scale. The clinical rotations are suspended for medical students, and the face-to-face teaching is changed to virtual platforms. The medical students are facing difficulties and stressful times which have arisen due to the widespread effects of the pandemic. So the conference gives us an opportunity to know how COVID-19 affects our medical education and students' learning experience from the students' perspective. Therefore, we can develop new or alternative effective teaching strategies and safe education in supporting and enhancing our medical students' educational and clinical experience among the concern and challenge during the pandemic. Also, I also hope that the conference will provide a unique opportunity for students from many universities to make lifelong friends and relationships. I'm certain that the conference will be a highly meaningful and informative event for all of you. Enjoy. Thank you.
Thank you so much, Ajahn Julapan. And next, I would like our 4 medical students from 4 countries, the speaker of today, to invite themselves. Let's get started with the host, Kaen University.
Hi, สวัสดีค่ะ I'm Chantarateera Pholvivat, and you can call me Katato. I'm from Faculty of Medicine, Kaen University in Thailand.
And the next one, the USA.
Hi, I'm Dzienny, and I'm from George Washington University School of Medicine and Health Sciences in Washington, D.C. in the United States.
Thank you. And next, Taiwan.
Hi, everyone. Good evening and maybe good morning. And I'm from Taiwan. I study in Chang University in my 4th year. Yes.
And the next one, China.
Hi everyone, I'm Fontong, Katato. You can call me Gung. I'm coming from Sun Yat-sen University of Medical School. I'm from here.
Thank you so much. Okay, let's move to our topic for today. And today I will ask the speaker to talk about the background information of your medical school and then the impact of COVID-19 on your medical school and personal life. And then I will ask about your opinion and your perspectives on medical school during COVID-19 pandemic. And the last one is if you can say anything about your medical school, what your ideal medical school will be like in new normal after the COVID ends. So let's get started with the first one. So I would like the host, Katato from Khon University, to talk about background information of your medical school, about the curriculums, academics and non-academic activities, and how is COVID-19 affecting your medical school and daily life right now.
Okay, thank you, Ms. Kanda. So our medical training in KKU, Thailand, we have the medical training for undergraduate, which is based on a 6-year curriculum, which can be divided into the first 3 preclinic years, where we will study through lectures and on basic science and laboratory, and also system-based models, which there will be also include the gross anatomy in this system-based model. And then the next 3 years would be the clinical years, where we would spend most of our time in the hospital studying clinical and non-technical skills and giving patient care and staying at night shifts and also doing ward rounds with staffs and residents. And for extracurricular activities, which for here I would include both the non-academic and academic activities, because nowadays most of my non-academic activities has gone through being academic and also be informative in their own way. So I'll just include it all together. For the first domain would be for the international domain, which we will host the ISEM International Challenge of Emergency Medicine every year, which I know some of your students has joined us as well. And we have elective programs and cultural exchanges like the ones that we just did between Thailand and Taiwan, and also Thailand and Japan. And for domestic areas, we have Su Sangkom Camp, which means for the community, that is held by our preclinic students to promote community medicine and also promote health education among the villages. Next, for the freshman students, we have a set of freshman ceremony and also the traditional singing to get to know them and for them to get to know us. And we also have projects for high schoolers such as the Med Camp, which is inspirational and also an introduction to our faculty. And also we have the Med Quiz, which is like a competition about biology, like high school biology. Yeah, so pretty much basically in our daily life would be going to the hospital for clinic students. We would go to do the ward rounds at 7. And then we would have some lectures and topic conference, and then another ward round in the afternoon, and then some after school meetings for extracurricular activities.
Okay, thank you, Katato. I'm sorry to interrupt a little bit. If you guys have any questions, please feel free to leave your question in the chat box. Like any language, can be English or Thai. Okay, please feel free to ask anytime. Okay, Katato, I heard that like your university have a lot of activities, and how is COVID-19 affecting them?
Well, actually, after the COVID came, most of our teachers are working harder than ever to make most of the lessons available online so that we can study at home. We did our exams on Moodle last semester, and also now we're studying online via Zoom, Google Meet, and also sometimes via YouTube, like the pre-recorded videos. And we will be doing this online study until November. But for the extern, which is the 6-year medical students, they have to do the clinical study, which requires them to be at the hospital. So now they're already there at Sinakurin Hospital after their 14 days quarantine to keep our patients safe. And for the extracurricular, we have it all kind of sorted a little bit right now because our president of the medical student union takes this as a challenge, not as a threat. And then we plan not to cancel the activities, but to postpone or make some activities online as much as possible to keep it going on. And actually right now we also have some ongoing activities as well. For example, the hashtag Together We Can, where we would sell t-shirts to support 20 hospitals. And also we have hashtag MDKKU Stronger, where we would ship medications to our patients' home and also make face shields for the medical teams, and also write songs or make infographics for the general public about COVID-19. Yeah, so our daily lives has changed, and we get up and study from home in a comfortable environment. And also we have, I think for me, we have more tasty meals, unlike the noodle, the instant noodle that we usually have. And we are able to stay with our parents and have effective online meetings to keep up with the extracurricular activities.
Thank you so much for sharing information about Khon Kaen University Medical School. And next, I would like to hear from Taiwan. Sam, could you please tell us about your university?
Okay, so we have 6 years of undergraduate years, and the following 2 years are so-called postgraduate years. During the 6 years, the first 2 years are mostly about general education, and starting from the 3rd year, we focus on some basic medical science. The 4th year is most likely our transition to clinical medicine, and like for the 2nd semester, which is right now for me, what we learn is mostly about more specific diseases and procedures. Also, something worth mentioning is that we started to have courses for which we have to go to the hospital this semester. We spent the last 2 years as undergraduate students in the hospital, which we call clerkship. We rotate from departments to departments to learn the stuff first-handedly and get to perform some procedures under supervision. And also our OSCE happens here. About the academic activities, actually we don't really have fixed annual academic activities. These things usually happen from time to time. They may be like workshops held by students' associations or medical conferences that allow medical students to participate. For examples, our university just hosted a conference. I think it's called Dialysis Access Synergy in March. And they did ask for some student volunteers from our faculty who would get full access to the 3-day conference for free. And for the non-academic activities, I mean, we are like normal college student that spend most of our time not in study. Okay, that's supposed to be a joke, but no one's laughing, so I guess that's quite true. But we do have a lot of extracurricular activities to participate. For the one that I met all the cool and hospitable friends from Khon Kaen, it's the cultural exchange we have every year. And also something like karaoke contests, talent shows that we call medical night, where a student can get on stage and perform whatever they are good at.
Okay,
yes, I guess that's the background information.
In your university, there are also like a lot of activities, right? And
yes.
like how is COVID-19 affecting those activities?
Like for most fourth year medical students here in Taiwan, the greatest impact must be our white coat ceremonies. For my school, it was originally scheduled at May 23rd this year, which is less than a month from now. And now it is rescheduled to mid-October because there have been restrictions like no more than 100 people in an indoor activities. And for like just like lectures, our university has forbidden every activities with more than 100 attendees. Also, they stop all the international programs like what I mentioned earlier. Yes.
And are you studying online right now?
Yes, online lectures are still going on. That kind of means more flexible timetable and locations of the lectures, but the efficacy of learning is not greatly compromised for me, but somehow I still miss being in classroom for lectures because of the instantaneity of the information I get without like lagging and teachers trying to figure out how to deal with computers. And another thing is that I miss seeing my classmates every day.
And so like nowadays you only study online?
For most class, because
For most
it's
class.
only for lectures that are less than 100 students. But it's actually, we actually haven't had any lockdown of any kind since the virus broke out here in Taiwan. Of course, if you're coming back from other countries, you have to be tested for the virus and being quarantined for like 2 weeks. But we are still allowed to go to places in Taiwan, just like travel around is allowed. We just have to watch out for our own sake.
So like in some activities that have like less than 100 people, you can still do it. For example, like you can practice in the hospital, right? If less
Yes.
than 100 people.
Yes, for courses less than 100 people, that is allowed. And actually, I've heard that the government is going to lift that restrictions also.
Okay, thank you so much, Sam. Like it's a very good point. And next, I would like to hear from China. Fontong, could you please give us some information about your university, please?
Hi, about information as Chinese student, we spend 5 years in the medical school from the first year till first semester, fourth year. As a preclinical study, usually the course is about lecture, case discussion, presentation, also experiment class and cross anatomy class from second semester of fourth year to fifth year. As a clinical study, we will practice and work in the hospital. It's like we can run ward and discuss about disease of the real patient. By fifth year, the school will separate us into each affiliated hospital in the east province. After graduate, if we want to work as a doctor in the hospital of FYSU, these are all the topical in the China. At least we have to get master degree or even a doctor degree. This means that as medical school students, we have to study and practice in hospital and do experiment in lab for another 3 years. What I have known that is like the most of doctor is famous hospitals such as our hospital in China have got medical of doctor degree already. And about the extra course academic activity, it depends on each month. The school or student will put some poster on the board and annoy us to join. Everybody can be free to join. Our university have a program to cooperate with other medical schools in China and from the overseas. They will invite other professors to give lecture about each topic that's minute in each month. Example like in 2018, our school have invited the Thai professor from Mahidol University, Prince of Songkhla University to give us lecture about some tropical medicine and biological safety. And about non-academic, it's like each year the school will have field trip by the purpose is to make us learning about Chinese culture. Also, the student will manage some concert during the New Year or singing in each month. We also still have sport meet between Chinese people and foreigners for every year. Yeah.
Okay. And what about the situation right now during the COVID-19? Is it affecting your medical school?
Yeah, of course, because the effect of learning situation is the school postpone all of the course activity, unless I'm studying at home by Chih will make by teacher will make the group of each course in WeChat, then learning from the online class by uploading as learning material before the class starts. And about for quiz and examination will depend on teacher of each course. Maybe we'll have every Friday like this. And about fifth year student, they have to go to hospital to study, right? But our teacher also have the video call record or calling video past WeChat, something like that for teaching students. Yeah.
Also, like you can't just still study from home, like no activity in the hospital.
Yes.
Okay. So like, what about what about the extern or like you study for 5 years, right?
Yeah.
So like the fifth year medical students still cannot go to the hospital too?
No, because in Chinese batch we have only 5 years.
5
Yeah.
year. Okay. So like you still can go to the hospital. Okay.
Like this.
Can you hear me? You guys, can you hear me?
I can hear you.
Yeah,
Okay,
yeah.
thank you. And thank you very much, Fontong. And next, let's hear from the USA. Alexa? Okay, I would like to ask you about the background information of your medical school and how is COVID-19 affecting your medical school and daily life.
Okay. To begin, I think our medical school structure is probably the most different from the 3 you already heard about. So we have a 4-year program. So before you go to medical school, you have 4 years of undergraduate degree where you get your bachelor's degree, and then you apply to medical school, which is an additional 4 years. So the first 1.5 years, you do your basic science lectures where you learn all the science and the physiology and the pathology and anatomy. And then after you finish that, so we finished in January, you take step 1 of the United States medical licensing exam, which they gave us 8 weeks to study, and then you take that exam, and then you come back, and then you're a 3rd year. You do your clinical rotations. We also call them clerkships, where you do all the core ones like medicine, surgery, pediatrics, etc. And then your 4th year, you apply to residency, and then you do acting internships where you act like you would as a resident. And then a lot of people do research during that time, and then you graduate and you match to your residency, and then you're basically done your 4th year. So a little bit about how that has been affected. So first years, they're still doing their basic science lectures right now. So everything for them has moved online. Our medical school is completely closed. No one can go because we can't have group gatherings of more than 10 people. So all of our lectures are online for the first years. And then the 3rd and 4th years who are supposed to be working in the hospital, they cannot work in the hospital at this time. And then for 2nd years, we have been off from school February and March to study for our exam. And we were supposed to take the exam in April, but the testing centers closed. So a lot of our exams got pushed until taking it to June. So right now we have just been studying indefinitely. I've been home with my family's home since February because I came home to study for the exam. So we don't really have anything from the school to be doing right now except for studying. We had a 2-week online course to introduce us to working to the hospital, where they taught us about the operations of the hospital and the electronic health systems and everything. But aside from that, we basically are just doing self-directed study for the exam, and we will take that whenever the exam centers open. And then the third years who are supposed to be in the hospital, they are now outside of the hospital. So the school provided them with some online virtual electives where they can still have learning from a distance taught by doctors. For example, they can have a course on radiology, which you can teach on a virtual manner because they just like read the films and everything. And then the fourth years, they matched to their residency programs in March, and they're out of the hospital. So they're basically just done with medical school and they're waiting for graduation. And then they will start their respective residency programs in July. So once they're a doctor, they can work in the hospital. Once they graduate, they're able to work in the hospital. But as a student, no one currently is allowed to be in the hospital. We are scheduled to start our rotations, our clerkships, at the end of June, beginning of July. They're letting students back in the hospital. But our school has also stated that that is subject to change depending on if we have a second wave, because a lot of, all of the states in the United States have been doing quarantine and social distancing. So all of our business, a lot of businesses have been closed except for grocery stores and restaurants for takeout. So they're starting to lift restrictions and let you go places. So our school predicts that we're going to have a second wave of like the virus outbreak. So if that happens, then our rotations will be pushed back again. So we kind of are waiting on that. In terms of extracurricular activities, I think it was also similar to like Taiwan. We have a lot of student interest groups that would be considered our extracurricular activities that we just meet and then we hold like group, we have speakers come or we do panels with doctors in different specialties, which those are all kind of just put on hold. A lot of the student interest groups just post resources such as podcasts or videos if you're interested in those topics to learn more about it while you have some free time at home and some flexibility with your schedule because everyone's kind of doing it online. And also we had, like our school does an annual medical research day where everyone presents their posters. So that also moved online where everyone just posted their abstracts in a book online. And then you can vote for whoever's research you like the most, they won an award. So that just went from being in person to being online, but there's no posters. Everyone just submitted an abstract for that. We also have like a student talent show day that was canceled because that was supposed to be back in March. So instead of doing that, they did videos, like each class could post a video that they wanted to show, which is just kind of funny. And it just showed what different people were doing. And so, but the school has had some activities where if you wanted, because a lot of people, like for myself, we've just been at home for almost like 4 or 5 months now and just studying. So I have a little bit more free time and flexibility than I had before. So they have a lot of efforts where you can volunteer. So you can volunteer to get together groceries and pack meals to give to elderly people who are not able to go to grocery stores because they're high risk for COVID. So they deliver meals to their doors. Also, a lot of our medical practices have moved to telehealth, where they do virtual consultations with their patients online. So a lot of students are able to help patients go on and set up Zoom meetings to teach them how to use the technology to make sure that those meetings go slowly. Aside from that, I think at least where I live, in the state I live, each state is different. It has been pretty strict in terms of social distancing. So I haven't been able to go to a lot of places. Like I can go to the grocery store, etc. But everything's been put on hold, like social activities, like can't really go out to eat with other people. I haven't been able to see my friends. So I've been doing a lot of FaceTime and Zoom and using Facebook and a lot of things to communicate. So I think that is basically the gist of everything. But if you have any questions, I can answer them at any time.
I really like the point that you talk about online virtual elective. Have you been in one? The online virtual elective?
So our class is transitioning to third year as soon as we start rotation. So we're still considered second years. So the online virtual electives are for the current third years who are supposed to be in the hospital right now. So I haven't been a part of them, but last week our school sent out an email to my class asking if we would be interested in doing a 2-week or 1-month course while we wait for electives. So some of the courses that are offered, it's a little bit more difficult because a lot of the electives you can't really do online because a lot of them it's patient interaction based. So the ones that they are able to give online are like a radiology where they go and teach you how to do like read different scans and imaging modalities. They also have one on quality and safety for medicine, just if you're interested in the more administrative side of medicine and how you can reduce medical errors and stuff like that. They also have one on medical Spanish because the United States has a large population of Spanish speaking individuals. So they have a class where you can brush up on like how to speak more Spanish terms, have a effective patient-doctor meeting if you have a Spanish-speaking patient. So those are just a few examples. But also third years, we take step 1 of our board exams, which I'm studying for now, and then you take step 2 at the end of your third year. So a lot of people take that in the fall, but since they're out of the hospital and they have a lot of free time now, a lot of people are studying it for it now. So when the testing centers open up, they can take step 2 when they're done. So third years are either doing a online elective or they're studying for the second half of our boards, if that makes sense.
Oh, okay. That's like a lot changes in your medical school. And so I would like to ask about like your thought about your school adaptation. Do you think it like is proper or not, Alexa? So you agree like you like how your school adapt during COVID-19?
I think given the circumstances, my school adapted as best as it could because basically we have federal guidelines for the whole country saying like we have to follow social distancing guidelines. So obviously I would like to be in the hospital and working on rotations, but that at the federal government level, that's not allowed right now. So a lot of the things that have been restricted are not necessarily because my school decided that, it's because they're following federal guidelines, if that makes sense. So I think my school is handling it in the best way it possibly could. If I had to make any changes, I would say, like I said, I haven't been in class since January of this year. So I think if they wanted to provide our class some sort of online elective course, that would be great. That would be my only criticism, but I think they're handling it in the best way that they can, given that medical students aren't allowed to be in the hospital and half of our medical education comes from learning in a hospital setting. So I think it's very difficult to get the same education while not being able to go into the hospital and like only doing things virtually.
Okay, thank you so much, Alexa. Like we got a lot from you. So So next, I would like to ask Fontong. Fontong, what are your thoughts about your school adaptation during the pandemic right now? And what do you think it would be like after the COVID-19 ends in terms of medical education and daily life of medical students?
Disagree about this because firstly the school must open around February, but the online class began to start from late April. With this make us wasting our time, and now the result is to study for whole day by weekday, and they also have class on Saturday. And about the after the COVID-19, I think it's nothing changed because from now other school in China it start to open again. So I think we might go back to have normal life as I wish it was before its pandemic state. Yeah.
Oh, so like you like how your school was before COVID-19?
Yeah.
So you like real classroom more than an online class?
Yeah. Because we can ask and we can help and can follow teacher by step. Yeah.
Mm. Are there any live session for student like live virtual classroom, or they just gave you a video and you watch it later?
In classroom, right? Or online course.
Or online classes?
Oh, some may have like live for let students in, but some have video record. Yeah.
So it's hard to ask the teacher.
Yeah.
Okay, thank you so much. And now I would like to hear from Sam. Okay.
Okay.
What
About
what are your thoughts about your school adaptation?
Okay, about the adaptations, I think they are understandable mostly because I think our daily lives are not greatly affected by the regulations have to be made. I mean, we don't have to do the quarantine even with like a few checkpoints with thermometers on campus. Everything is still quite normal, I'd say. So as I mentioned, we started to go to the hospital from this semester. For the first week, we weren't even allowed to the hospital. Actually, there's a funny story that in a press conference, the government accidentally revealed that a few of the cases are diagnosed in the hospital that we were supposed to go to, which they shouldn't reveal. And then the next day, our school announced that we shouldn't go to the hospital for the first few weeks. So for now, we are allowed back to the hospital for this course called Clinical Diagnostics. As you may imagine, this course is generally about learning physical examination, history taking to make preliminary diagnosis, which contacting with patients is inevitable. But most departments right now won't let us do that. It's sad, but kind of fair. The one thing that I'm not happy with is this, since this is the first opportunity for us to actually interact with patients and do something almost like practicing medicine. It's kind of a bummer that this chance is now compromised because of the virus, especially in the kind of basic skills like history taking that takes experiences to sharpen. And for the sake of the patient, it might be the right thing to do. Contacting with less people sure lessen the risks of being infected. But still, I don't want to be seen like unqualified when the time comes.
Okay, and what would it be like after the COVID-19 ends, in your opinion, about your medical education and life?
So.
Oh my God, it would.
Okay, it's cool. I can still see the questions. So I won't say it's gonna affect my study future in a bad way. Now, mostly clinical, if I see it in big pictures. I'd say it's one of the many risks we all to face at some point in our career. So I can see how this shouldn't be an opportunity for us to learn from. I'm not saying that we need to know how to handle patients with COVID-19 right now, but this should be a good chance for us to know about self-protection and some basic real-time public health issues, since these are the kind of the things we cannot just run away from in the future. This pandemic right now is a major problem, and I think it always will be, but in a different way. Just like how we look back to SARS, this pandemic will maybe be written into the textbooks, because this is definitely not a one-time thing.
Oh, this was a great point. Like after the COVID, we have learned a lot.
Yes, but I think I can say that mostly because the situation here now in Taiwan is not serious enough that we cannot go to the hospital. We can still go to the hospital. Our senior students, like for the 5th year and 6th year student, they are still going to the hospital for the clerkship, not like in the US. So they are still having the education they should have. So I think I can make that point because of this situation right now.
Okay, thank you so much, Sam from Taiwan. And so the last speaker for this question, Katato from Khon University. What are your thoughts about your school adaptation, and what would it be like after the COVID ends?
Well, actually, I kind of agree with all the three of them partially, because I think that it's good for the time being, like for now, since like it's better for us to keep our physical distance between us and the patients, and also us and the world. I mean, the people shopping outside, and also to keep our patients safe by reducing the exposure and also the risk of asymptomatic spread of COVID-19. Actually, and also for some academic activities is getting better too during the quarantine and the shutdown. For example, like here in KKU, my kind teachers are actually hosting international webinars. So now we can learn new concepts without having to export ourselves or import the speakers in, which saves, both time and traveling, and also still learn the topic. But the study for us, however, I think it requires much more like discipline to really, sit ourselves down and study in our own house and like the cool environment to like study, and especially for those who have courses via pre-recorded YouTube lessons, which might actually eventually take up our free time if we postpone it, or it might even got taken over by our free time watching like, some other videos on YouTube, cat videos instead of lessons. And I think but still the pre-recorded videos have the bright side to it, which is that you can pause anytime, you can make it fast or slow, and you can like schedule your own time if you have to go outside or something, which is kind of great. But for me, I think I find it easier to have like a preset schedule, like on those that are studying via live, like on Zoom or on Google Meet, so that we would know exactly when it would end. Either way, both the pre-recorded and the ones that I'm taking, the live ones, we still have to stare at the screen a lot. So that's quite a bit of a downside, because some people find it tiring for their eyes and also for the back, like to sit here watching the screen all the time. And also some find it boring without those like clinical activities and also the interactions that we usually have in our classes. And yeah, there's also more distraction actually, apart from the internet and everything. There's also like problems like loud neighbors or inviting snack stack, and also like sometimes just your bed that would distract you from the lesson. So yeah, there's pros and cons of studying online, and I think there's still room for improvement, especially in the fairness and the transparency of online exams. Yeah.
Oh, I totally agree. And another question, what would it be like after COVID-19 in terms of medical education and your daily life as medical students?
Well, I think like for here in Khon University, right? I think what happens for med ed actually depends on what we think about this new normal, like both the students and the teachers, because here in Faculty of Medicine, the faculty always asks for our opinions so that they could make changes that is the most suitable for all of us, and also the next changes for the better solution every other time to fix any like defects or bugs that came up on the way. Yeah. But for medical education in general, I think there might be more new technologies like the AR or applications or robots like the ones we have now for talking with the patients, and like virtual reality and stuff, so that we can practice at home, like improve the clinical skill study from home, like the ones that they already have for the higher level of medical study. For example, like the ones that you have little controllers for the like surgery doctors, the surgeons, yeah. And for the lifestyle, I think, well, I think that it might be better for patients as there might be lower spread. I hope that there might be lower spread of hospital-acquired infections by healthcare personnel, because we see and we practice the, hand hygiene these days. Much, I think, might be like more of a topic these days, because we see that it's effective to prevent spread of germs. And I also think that if other people in the society take the idea as well, it'd be great. Yeah.
Okay, those were very good points. And before we move to the next question, there are some questions from the participants. The first question, this question is for Alexa from the USA. The question is the adapted of the program applied to all medical school in the in the States? For example, like the 4th year resident is automatically graduated?
I would say for the most part, it's pretty standard. I mean, there's differences in different schools. There's not like a big law, but like the graduation requirements are the same at each school. So I would say that since the majority of 4th years aren't able to be in the hospital and they already matched to their residency programs, they fulfilled all their requirements for schools. I would say the majority are just free and graduated. I will say that a couple of schools, for example, New York University, they allowed 4th year residents to start working at the hospitals as hired interns. So they are paid to work instead of waiting for residency. They are able to go work in the hospital on the front line to help deal with the mass of people coming in because of COVID infections. So I think it's kind of cool, depending on where you are and depending on your school. Some will allow you to work, and then some just say kind of just stay home or work on research remotely. But I would say for the most part that 4th year is a very flexible year in general for all medical students, because a lot of the time you're just finishing up your electives, you're finishing up your research, you're doing a lot of life things. So I would say that's pretty true for the majority of schools in the US.
Okay, and in terms of medical school in the USA, what would it be like after the COVID ends, in your opinion?
I think I kind of agreed with everyone saying. I also believe what you were saying about the hand hygiene was such a good point. I think right now, the public community is really taking their own health safety into their own hands. So you see a lot of people wearing the masks and a lot of people carrying hand sanitizer around all the time. So I hope that's something that definitely continues and people still take responsibility for their own health in that way. Also, like I mentioned before, a lot of medical specialties that aren't emergency based, or they don't need to be in the hospital, they're doing a lot of telehealth communications. And I think both the doctors and the patients have really appreciated having that service, because sometimes patients aren't able to come in to see their doctors for a variety of reasons, maybe transportation, maybe it's far away. So I think going forward, people will start using telehealth a lot more commonly for non-emergent physician consultations. For example, if you just have a cold and you need to go figure out what kind of medicine to take, or you have a rash or something like that, something that you don't necessarily need to be in person to consult on. But I think that for the most part, I think everything will go back to normal. I think the community right now has really respected healthcare professionals. So I think they carry a lot of weight in our society right now. So I hope people will be more cognizant of being safe and what it means to, like, you have to take care of your health to protect the health of your family and other people around you. I think that will be the major takeaway of everything.
Okay, thank you so much, Alexa, for answering the question. And the other question is for Taiwan. The question is, since you mentioned that we will have less hours learning in the hospital, do you think it should be a make-up time for you, that you will learn all the stuff that been missing, like extending academic semester?
Oh, okay. So, concerning the stuff that we've been missing, I don't think it will be necessary to do that, like extending academic semester or have a makeup time for that, because I think those are the skills that we are going to know a thing or two about. Starting to do that this semester will eventually be picked up after like years and years of medical practices. And frankly speaking, I'm still a student. I still have I still eager for those vacations. So I wouldn't think it would be necessary. And another thing is that because of the fixed curriculum of medical school, I don't think it would be possible. But that is not really necessary, because I think those skills can be picked up after like maybe in the 5th or 6th year. It won't make a difference in the 6th year or even after we graduate. But maybe in the beginning of the 5th year, when we start our clerkship, we will have to like take more effort into accommodating into the clinical fields. But I think that is not very essential in terms of like long-term speaking. Yes.
Okay, thank you very much for answering. So let's move to the last question. Okay, let's get started with Katato from Khon University. If you could make any changes to your medical school, what would you like it to be in the new normal in a long run after COVID ends?
Well, actually, the changes that I like are the changes that the faculty already did, most of them. Like, for example, having pre-clinic students to get an early exposure to the clinical skills and also the non-technical skills too, which I find important. And so from that, they would get more inspiration and do well in their clinic years. And like for the, I think for after the COVID, for those who take COVID seriously, I mean, who follow the news and things and also make infographics through our projects, will make them like more eager to help other people and also more like have more assertiveness and something like that. And also, but I think for clinical students, it can be better, or it would be nice to have new technologies and more tools that we can like provide for as clinical students to practice the clinical skills at home, no matter if there's a pandemic going on or not, so that we can have more, dexterity, and also we can be prepared if this ever happens again, or like as Alexa said, if there's like a second wave. Yeah, so we can be prepared.
Okay, thank you very much, Kotu. And next, Sam. What? Mhm.
Okay. For I know, education in Asia generally has already been limiting for students, and funny how they like suddenly open courses of different fields in the university and want us to explore our interests, but they want us to do that, but mandatorily. So I would make that like into like voluntary courses, and for other things I was pretty glad about them. So I might not change too much about it. So because there have already been so many good examples that were cultivated by the current systems, and people will continue to like make the system better. And also I believe it's one thing to be in the system and have some opinions, but it's another thing to design a whole system from scratch. So I actually don't know how to, I don't have a big picture of it, but I think I'm pretty satisfied with what I have right now.
Okay, seems like you have a fan club right here. There a comment said, "Good point, Sam. I'm looking forward to having vacations with you."
Okay, everyone
Okay,
can
thank you
ignore
very
that.
much.
Can just ignore that.
Like, it's great, like someone really listen to you. Like, it's good point. Okay, and let's hear from Fontong. Fontong, could you please answer this question? If you could make any changes to your medical school, what would you like it to be in the new normal after the COVID-19?
Okay. I would like to create school that can combine both traditional pattern and online course, like for anatomical class, lab practice in hospital. I think it's better to have teacher in class and can communicate with them, follow by step by step. This can be replaced by the online course, but for academic course and lecture, maybe learning online is another good choice.
But you prefer the real classroom,
Wait,
right?
can you hear me?
Okay. Yes, I can hear you. Like you already like how your school is right now. Like don't have to go online. Like better to learn in real classroom.
No, I mean it's like I would like to create the school is combine both of them, like traditional
Okay.
pattern and online course. Yeah.
Okay. Thank you very much, Fontong. And the last one, Alexa, what do you think? If you can make any changes, and what your ideal medical school gonna be like?
I'm happy with my curriculum as it stands, but I think if I were to change anything, I would give more clinical time, because I was in Thailand over the summer and I like how you have 3 years of clinical experience in the clinic in the hospital starting from 4th year, I believe. So I think you learn a lot more and a lot faster in a more memorable and productive way in the hospital setting when you can actually see the patients and see the patient presentations. I think it's a lot more effective than just like reading a bunch of symptoms on a book. So I think if I were to change anything, I would de-emphasize the first 2 years of basic science, because I think our medical system as a whole is very geared to exams and passing our step 1 exam. So I think if I were to change anything, I would just make maybe the basic science shorter and then have more clinical experience, because I think you learn a lot of that basic science during your clinical experience anyway. So I don't think you would lose anything. And a lot of us come from, I had a 4-year background in biology before I came to medical school. So I would have preferred to have more time in the hospital. Like what Sam was saying, to learn more of those skills that you really need practice on, like interviewing a patient, doing a physical exam, coming up with a differential diagnosis, things you can't really learn from a book. You just have to go through the mental process in person and become better at it. So that's what I would change. But overall, I'm happy with my program. I think we do have a lot of clinical time, and even during our preclinical years, we have required sessions in a clinic with a doctor seeing patients. So I think they do a good job trying to integrate as much clinical experience as possible.
Okay, thank you very much, Alexa. So now it's time for the Q&A. Okay, if you have any questions, please feel free to ask. You can turn on your microphone or just write down into the chat box and I will read it for them. And you can also type in any language, maybe English or your language. Please feel free to ask. Okay, there are a few questions. Okay, this question is from Walisala. The question is for all of you. Okay, what you guys most like and dislike about adaptation program during COVID-19? Hello? Okay, can you hear me?
I can hear you. Yeah.
Okay. So let's get started with you first, Alexa. Like, what you most like is like adapted program during COVID-19 in your school.
I think I'm in a unique situation because I'm supposed to be studying for an exam, so I'm not really doing classes like everyone else. So I feel like you guys might have more opinions about being online versus not being online. That being said, I don't like how I've been extended studying. I was supposed to take my exam April 6th, and now I'm not taking it until June. So it's just a really, really long time to be studying. So it's kind of difficult to not be burned out or to stay motivated with having a big exam, but also my exam date has been changed multiple times. So there's just like a lot of uncertainty of when I will take that exam. And since the exam is so important, it's kind of been a stressful situation. But overall, like my daily life hasn't been affected. Like I haven't had to transition to online classes or anything like that. So.
Okay, thank you so much, Alexa. And what about you, Sam? What is what you most like and dislike?
Okay, so I'd say for the both question, it's the online courses. I'm really conflicted by this online courses because for one thing, now it's really the flexibility is what I love because I can like in any morning I can just go to a cafe which I like to have the course, and I can like I usually have to get up half an hour before the course started, but now I just have to like 10 minutes before the class, I just have to log into the account and then I can start the class. But also like every class we have to spend 10 to 20 minutes to wait for the doctors to get online and share their PowerPoints, their slides. So there have been pros and cons about the online courses, but because the other things are not really, there haven't been a lot of influences by the virus, but for the online courses, I am really conflicted by it. Yes, I think that's all. Hello?
No, Kanda, you're there?
She's gone?
Well, for now, then maybe I'll just continue with like the next me and then Fontong. And
I am so sorry.
Oh, okay. You're back.
I am so sorry, guys. Okay, and next, the same question: what you most like and dislike about the adapted programs during COVID-19 เข้าสู่from Khon University?
Yeah, well, I think I like that we still keep ourselves connected online. Like, well, this year, the 5th year students, us will be like responsible for the student union. So we have to host many extracurricular activities. And I think it's nice that we still do that, although there's still like diseases going on and that we can't really go meet each other face to face, but we still make it happen via online and have even more effective meetings online so that we don't have to wait for people, we don't have to travel, we just like sit in our home having snacks and like just get things done. Yeah. So that is kind of nice. And the thing that I don't like is that the fact that we can't meet in person, because sometimes it's nicer to speak in person, like both emotionally and also, you know, just to stay human. Yeah. So yeah, it's kind of sad to not meet people, and also, but yeah, it's still good and bad at the same time. It's good that we can still find a way to fix it, but we still miss the old days.
Okay, thank you very much, Kotu. And there is another question from Natapatra. Like, she said, hi, after the COVID-19, what are you guys' opinion about merging the online course in the new normal curriculum? Okay, so continue with Kotu.
Well, I think like I mentioned before that most of the decisions that are made in our faculty will be based on opinions of most of us. So I think after the COVID-19, the faculty will have some kind of survey to ask us and also the teachers, because, you know, we have many professors and those who find it difficult to use computer and make online courses. So if they can catch up with this, with all the time that we have, because we are doing online courses from now until November, right? If they can catch up and they find it easier, maybe we can make most of the courses online so that they can teach and, I don't know, maybe record it so they don't have to speak the same topic again and again every time we rotate to them. But if most of the teachers find it difficult to do this, we might have to go back to what we usually do, which is going face-to-face and teach the lessons over and over by the kind teachers, yeah. Which is nice either way.
Okay, thank you. Thank you very much, Kotu. And okay, and the next question is from Kumchano. She said, I have a question for Sam. Sam from Taiwan. I heard that in Taiwan, you can still go to medical school in clinical years. I want to know if there are any restriction in your clinical clerkship, for example, in suspected COVID case.
Okay, for this, because I'm still not in my clerkship, so I'm not sure about what I'm going to say if they're right. But what I heard is that I mentioned earlier about for the first few weeks we weren't able to get to the hospital for the courses. For students in clerkships, they couldn't go there at first too. So they were assigned to other hospitals because our hospital is it's like a big medical system in Taiwan. They have several different hospitals, so they were assigned to different hospitals where the situation were not that tense. And I've heard that they were not allowed to be near to the COVID cases. If they would have to do their quarantine too. So that's what I've heard. But everything else, I think it's quite the same, especially when now things are not that tense. Everything is easier for them to do. Yes.
Okay, thank you very much, Sam. Okay, the next question is from Palan Yu. From Palan Yu. Palan Yu is a head of SMST Thailand, and he asked, which features of online courses or adapted programs in the period do you think that would be still active or can be also adapted in normal programs? Okay, and he asked you all. Okay, let's start with Alexa.
Hi. Okay. This one, I think for us, but even before COVID, a lot of our lectures, we only had certain required lectures where you had to meet in person, but the majority of our lectures, you had the option of attending them in class, but all of our lectures were recorded. So you could also watch them later that day once they were posted online. So I think our school is very unique in that we kind of already had the option of, if you wanted to attend in class with people, you can, but if you also prefer the flexibility of having online classes, you could also do that, because the majority of our lectures were not required unless there were small group sessions where you had to work collaboratively as a team. So I think moving forward, we're still going to have the option to have online classes. I don't think that will change for us too much. I think if anything, like we learned how to use technologies like Zoom and WebEx. So I think in the future, if ever there was like a reason we couldn't go to school, like maybe we had inclement weather, like sometimes we have snow days where we can't attend classes. I think now we have the technology to figure out how to attend class from your apartment so you don't have to go in. But for the most part, I don't think for our specific program in the US, since we already had the option to do online classes before, I don't think that will change that much after COVID.
Okay, thank you so much, Alexa. And next, the same question I would like to ask Fontong from China. The question, I will repeat the question again. Paran, you asked, what features of adapted programs or online course you think that would be used in normal programs?
I think it's like for academic course or like lecture, we can continue with by study at home, because some of us, when it have the class in the room, even me, it's not only every day we go to class, so it's easy to study at home. Yeah.
Okay, thank you very much. And I would like to hear from Katato, Khon University. What feature of adapted programs you think that would be used in normal programs?
Oh, I think I kind of like the ones that we do the quizzes before our lessons, which is kind of nice when we do the online exams, because normally if we're in class and we have quizzes before, we have to like go connect our internet and do things, and then the class will have to wait. But here in online, we can take the quiz pre-hand and then attend the class like right after. So there's less the waiting. Yes, so I think that's kind of nice and can be adapted, like to do quizzes before the class instead of like come in and then everybody do it together and wait for the others, like that.
Okay, and thank you so much, Koto. And The last one, Sam from Taiwan. Could you please answer this question?
Oh, okay. So I think everything will go back to what it was before COVID-19 because our school is a rather traditional one. I don't think they will let us do the online thing after the COVID-19. And personally, I prefer going to classrooms because I need the motivation of being there. If I can do the online courses, I don't think I would be doing great. Yes,
Okay.
that's for
Like,
me.
there are some motivation you get from the real classroom than virtual classroom.
Yes, I'm that kind of guy that I need to be pushed to go to classes. And being in the classroom is one of the reasons. I have to be in the classroom is one of the motivation for me.
Okay, thank you very much. Are there any questions? Okay, maybe this is the last question. Have anyone had online exam like Khon University, and how was it done? Sam, do you have online exam yet?
No, I haven't, but I've heard a few students have, and I actually don't know how that works because apparently you are not really like seen by some teachers or something. I think I don't know. I don't know how that works, and I haven't had the experience of that.
Okay, thank you. And next, Alexa, have you ever done online course, the online exam?
I personally haven't, but all of our first year medical students have, and so I'm friends with a couple of them, so I can kind of speak to how those operate. So they're online, and you have to literally have a video camera set up of you taking the exam, so you can prove that you're not looking at other material, and you're not allowed to have any other paper on your desk unless it's approved, or you can't have any food or water. You can't have anything on your desk unless you had prior approval from the school. And during a regular exam, you can go to the bathroom, you can sign in or out during the exam if you need to use the restroom or something. So when you're doing the online exam, you can only leave your desk during scheduled breaks. So I think they pause your exam. So those are some of the ways they mitigate, like to ensure people aren't going to cheat or something, that they just record you watching it. You can't have anything on your desk. You can't leave your desk unless it's a scheduled break.
Okay, thank you for sharing your experiences. So next, Fontong from China. Have you ever had online exam?
Yeah, we already have online exam. It's like they will put like 20 questions, but they have only 20 minutes for us like that on WeChat. We can scan barcodes and then do it. If we cannot submit, is that all cancelled for us? So we have to farther to do it. So it's so hard.
Like it's harder than normal exam?
Yeah, of course. Because maybe they're so scared is about us is study at home is like too easy to open book, right? But it's not hard. It's not easy because it's like we have timer, so we have to do it faster. Yeah.
So you don't have time to cheat?
Yeah.
Okay, but did you open your camera to let your teacher see your face?
No, it's not.
Oh, okay, it's just like make the time control you.
Yeah.
Okay, thank you very much. And the last one, how to from Khon University, Thailand.
You mean like for the exam, online exam in KKU, right?
Yes,
Well,
I know you have done some.
yeah, well, actually, there's a few, and it's different between departments. The one that I take didn't require any videoing, and it is based on trust that we will not cheat. That's one. That's like the first one, that like the prototype of it. So, and then the next one that follows would do the ones that with the video on, and also, yeah, I'm not sure if how the other works, but there's still the ones that also does like what Fontong says. There are the ones that limit the time, and the questions would be exactly the same so that we can't look up anything. And there would also be some departments that would let us freely look for, resources, which I think is kind of nice, because in real life we can look up things, right, when we do things to make sure and to make the patient safe, right? So those departments allow us to read anything, have the resources here, and also have the camera on, and then type up our answers, mostly the ones that requires typing, and some are MCQs. But the ones that we are still thinking of how to do it is the OSCE test, which I haven't experienced yet online, because normally we would have to have like a 1-1 exam with the teacher in a separate room to see how that works. I heard that in Taiwan you already have OSCEs online, right? Did you?
I don't know. I don't know. I honestly don't know.
Okay, it's okay. Here in Thailand, there are some other university that do OSCEs online, and they require it's like a video chat with the teacher and do the OSCE on themselves. So we're thinking about that too, but we haven't tried OSCEs yet.
Okay, thank you very much, Kotu. And that is a question privately sent to me asking, Alexa, is your exam on paper and how or is on the computer? How do you send back to your teacher? Like about your online exam.
Oh, for the online exams, they're on the computer. We have a specific exam software that even when we take them in person, they gave us iPads to take them on. So everything is online, so they get the results instantaneously.
Okay, thank you very much. Are there any questions? I think it's all for today, and thank you very much for joining us in today's webinar. And if there are any mistake, we are really sorry, because this is our first time doing webinar, and I hope what our speakers share today will be beneficial to our medical education in the future. Thank you very much. That's all for today. And thank you all the speakers.
Thank you.
Thank you.